Coming back to Dr. Ambrish once again to you. And let's be honest, men often talk about the horsepower of their car, but when it comes to the blood flow of their body, they subtly avoid the subject. So why is sexual talk, their libido, or let's say the blood flow of their actual body such a big taboo when it comes to talking about it?
I think talking about libido and sexual problems is a taboo in almost all cultures for men.
Right.
And I think this is obviously linked again to the same thing about being macho and being a man, and and the moment you admit that there is a libido problem or an erectile dysfunction, already you're sort of putting yourself on a lower platform than your peers, and you say, I'm the only one probably in this group which is facing such problems, and how can I admit it without knowing that at least half of them possibly have the same issue. So I think it's all in the mind. It's about how people will judge you, even with doctors, even with people like us. Only those patients, either who are really distressed about their marriage falling apart, they come with these issues, or those who have become very close to you over the years will gently then ask the other staff to go out, can I talk for 1 minute? And then they will mention that there is an issue about this. Now, we also tried proactively asking people. So it works in some people, many don't appreciate it at all. Mm-hmm. And the reaction is like, of course not, that's not an issue. So, so there is definitely a barrier there. It's a social, cultural barrier, cuts across all cultures, as I said, more in some than others. The more aware a society, the more educated a society, the less this problem is. But yes, I think it is very, very important. Because sexual health will determine your overall health. Determine means that if there is complete lack of sexual satisfaction in someone's life, it affects their overall health for sure, including mental health. Other way around, it may be a reflection of your blood flow, as you pointed out.
Right.
So actually, when people with diabetes or blood pressure or heart disease, when the blood flow to the heart narrows, the blood flow to the brain goes down. Same time, the blood flow to the genitals also goes down. So penile blood flow may go down, and that's why there may be a real problem.
Right.
And many of these can be helped by adequate and appropriate intervention.
Right.
So not sharing with a doctor is not a great idea. There can be two broad pathological reasons. One is what I said is the blood flow reason.
Right.
Not uncommon at all. And the other is testosterone deficiency. As men age, there are issues with testosterone. Right. If you want, we can discuss that later.
Sure.
But the fact is that we should be aware of these, and we should be asking our doctor if there is any such concern. Because by ignoring it, we are not going to help ourselves at all. The third, of course, one is testosterone, yes. Other is blood flow, and the third most common is psychological or
right.
incompatibility.
Right. Well, my takeaway from this would be, okay, I understand there is a taboo and it will remain for quite some time across all cultures. Well, don't talk about it socially, but at least talk to your doctor. Yes, it'll just
absolutely.
Improve your own life.
Yes.
So on that point of testosterone, my next question is coming to you, Tarun. Do you know that lack of sleep is actually because of low testosterone levels? So when will men actually stop bragging about only 4 hours of sleep is needed and actually address the real issue?